Good morning, Murrell, Dobbins. My name is Ishine Robinson, class of 2024, and we're the Biotechnology students here with Dr. Ellis Stanford, and she's here to answer questions about the COVID-19 vaccine.
Hey Dobbins, my name is Zoray Agron, class of 2024.
Hi, my name is Taahzje Ellis, class of 2024. And just before we get started, I want to thank Dr. Ayla Stanford for coming here and answering these questions that we all have.
You are so welcome. Thank you for inviting me and sitting with you all today.
Before we get to the questions that the students have asked, we wanted to give you our opinions on the COVID vaccine first.
All right.
My opinion is, well, as me being a student athlete, I had to get fully vaccinated, but like I don't think that I don't think it's a bad thing. Like if you really care for your health and your safety, you should really get the vaccine. That's my opinion on it.
Okay. I mean, I think certainly for sports especially, and I'll speak for the folks who did not or don't want to be vaccinated. I mean, when you're playing against opposing teams, they're from all over. They might not just be from your neighborhood. So they're bringing their germs from their bubble mixed with your germs. People yelling, might be sweating, touching a ball perhaps. And those are all ways that the virus can be transmitted. People wanted their games and their season to stay in session. There were a lot of cancellations and so forth because teams had COVID and stuff was shut down. So this reduced that. And then for those students who are phenomenal athletes that had an opportunity to get scholarships and so forth, this allowed that not to be blocked for them because they were able to participate. So I think for sports, like it or not, right, you want to be able to perfect your craft and benefit from that skill that God gave you. So I think for the sports athletes, all for it for a bunch of reasons.
So for my opinion is I have the vaccine, only the first one, because personally that's what I like. I did it so that way just in case I do get COVID, my immune system will like be protected, you know? I won't be that sick. I don't want to get the other vaccines, just the first one.
So thank you for your honesty. One only gives you half as much protection, right? And so it's the two together that increase the level. It's, for example, and you may not remember this because you were a baby, but measles, mumps, and rubella, for example, the MMR shot, you get a couple of those because the two of them together increase your level of protection, right? And that's no different than the COVID vaccine. And so I would suggest you get it, especially right now because the rates are starting to go up in the city again with BA2 and Omicron. And right now for you, the benefit is that you're getting a dose now and your levels are going to be higher than most people that got their second dose several months ago, right? How'd you feel after your first shot?
I actually felt like fine, just a sore arm, just give it like 2 days and it goes away. But I felt just fine.
Did you know anybody in your life that had COVID?
Yes, unfortunately, some family from PR, they died because of COVID. But I feel like COVID affects everyone differently. It depends on our immune system, our health. But personally, like from my household, we were just fine when we had the vaccine.
So this is what I'll share with you. And she's right. COVID affects everyone differently. And I'm sorry that you lost family members.
Oh, no, it's fine.
Statistically, younger people, stronger immune systems that are healthy will not be as sick. But that does not mean that someone you come in contact with at your church, your coach, your teacher, and for that matter, your baby sister or cousin who's too young to get vaccinated, you don't know how it's going to impact them. And so when it's a public health crisis, what you do affects everybody else, right? And so that's also, it's not just about how it may make you feel, but it's also how it can impact someone else's life. And I know that requires us all to dig deep because you're like, why should I think about that person? That person's not thinking about me. But the fewer people that are unvaccinated, the sooner this whole pandemic is over or less because the virus lives in people that don't have immunity. That's how it replicates. That's how it becomes stronger. So I would recommend, that you do for those reasons.
Okay.
My opinion is surrounding religion, because a lot of people in my family did not want to get it because of religious reasons, and I'm just curious of what do you think about that whole side of not getting the vaccine for that reason?
So I think for different faiths, and I've heard different things, mainly Muslim, but not Christian so much, right? About your body being your temple and not putting anything that you think is impure into your body and things like that. And I am a person of faith, and certainly everything that I've accomplished and what we've been able to do with the consortium, I believe is all divine guidance, if you will. And so I don't believe that the opportunities that I've had, the ability to service other people, could only have happened through God. So I don't believe that God put me here to do the things that I'm doing, and then at the same time is saying, but don't take what I gave her the gift to give you, right? So it doesn't mesh well with me. Now, some people will say, for example, I would rather die than receive the vaccine. But that's a choice that they make. But I do not believe that they should put the Bible or the Quran or whatever your sort of biblical or whatever your guide of faith is as your reason for not, because it's not written anywhere in any of those books that you should not receive it.
So now we want to get into the questions that students have asked.
Okay.
And my personal question, it goes off what he says. The Philadelphia School District has banned exemption forms, like, for sports leagues, and I wanted to know, like, how did you feel about that?
So that they banned exemptions, meaning there's no reason you can put forth to say
That you cannot get the COVID
you
vaccine.
cannot get the vaccine.
Yes.
So, I mean, I'll just take it, you could take the sports out of it, because it's really exemption forms for anything. There's no most of the medical exemptions people would bring forth are only more justification for why you should be vaccinated. So anybody who has a weak immune system or they're immunosuppressed, that's just more reason why you should get vaccinated. Like right now, with the fourth shot, people who have weakened immune system, and that includes children, they're recommending that you get a fourth shot so you can be protected. And so I support that. What I found a lot of going to the schools throughout this time is that a lot of the students were ill-informed for the information, and some of that misinformation came from parents and other people who didn't know, right? And so there's no aborted fetuses in the vaccine. There's no eggs in the vaccine if you're allergic to those things. So there's none of those things exist. And because we have more than one, if that one didn't work for you, then there's another one for you to take. So there's really no true exemption, you know what I'm saying, for it. And if that's the case, then you probably couldn't be in school anyway. So I support that, yes. I support it.
Another question that was asked most commonly about, it was mostly females, they want to know if, will the vaccine stop me from having children and cause infertility?
So that is an excellent question. When we first started administering and people were receiving the vaccine, it was December, because I got my vaccine December 16th, 2020. So this December will be 2 years since I got my first shot. When that question came up initially, we didn't have enough data to answer that question. Now, with December 2022 almost around the corner, people have tried to get pregnant, got pregnant. People have had babies, delivered babies, and are on the other side, and some of them have gotten boosters. So all those questions about, is it going to make me infertile, or can I have a child, have been answered because you can see the results of it. We do know that about 300 women, pregnant women, died from COVID because they were immunosuppressed during this year. I should say, during the pandemic, because this year is only 3-4 months in, from coronavirus disease. Some of them lost their babies because you are immunosuppressed when you're pregnant. We also know that the antibodies from the mom when they get the shot is in the umbilical cord, so that goes to the baby and protects the baby. And so, and I know that's a woman question, but the woman didn't get pregnant by themselves, right? So obviously the man was fertile, right, in order to get a woman pregnant. And so that is not true, regardless of what Cardi B says.
Okay.
Even though I love Cardi B, I'm just saying.
This next question is a question that I've heard a lot since the vaccine first came out, and it is, what's the point of the vaccine if I can still get COVID-19?
Oh, such good questions. Let's break kids here. Okay. The vaccine is supposed to do several things. One, it's to prevent you from getting COVID. Two, it's to make, if you get COVID, that it's less severe. 3, to prevent you from going to the hospital with COVID. And 4, to prevent you from dying from COVID. So that is what the vaccine is designed to do. And it's a spectrum. So some people won't get it at all. Some people, if you are vaccinated and you get it, it'll be less severe. So the people that you hear getting COVID now, they're home. They're pissed. Their nose is stuffy. They can't eat, but they're not in the hospital jacked up. And especially if they have a chance to tell you, man, I can't believe I got COVID again, then they're okay. Because a person who's sick can't even complain about it because it's hard for them to breathe, right? And so those 4 things, remember that, is to, 1, prevent you from getting COVID, having a less severe COVID experience, hospitalized, that you don't go to the hospital, or dying. That's what it's supposed to do. So if you got COVID again, but you were home complaining about the fact that you got COVID and you weren't in the hospital and you lived to see another day, the vaccine did its job. The other reason, back to you, is because the vaccine the virus only lives and grows and becomes more potent and stronger in unvaccinated people because they have, or people who are not fully protected. And that's how the virus has a chance to duplicate and become more strong.
Okay. I had a question about how us, the people, are handling this pandemic, with cities opening and closing and us really trying to get our normal lives back, and with the government not really, I wouldn't say controlling, but handling the situation well. And then we have young doctors who are trying their hardest, working overnight, trying to provide people with the COVID vaccine with clinics and other places like that. But people just don't really trust it with a lot of the rumors and stuff going on. And I want to know, how do you think we're handling the situation? Do you think we're handling it well?
Handling meaning the leaders that were put in place to handle it correctly?
Yes.
Well, I think it was handled suboptimally, meaning there was lots of room for improvement. Certainly in the beginning, there were many mixed messages, too many mixed messages. And at the time when you first had everyone's attention, that's when it needed to be as clear as could be. And it wasn't. It was as clear as mud. And so after that, people stopped paying attention because it was an old white disease when you take a cruise and you travel to exotic places in the winter. Well, that wasn't anybody black or Latinx. That wasn't. So folks were like, oh, that's a rich person's disease and black people can't get COVID. And then once that started to spread, it took months till you could undo that, right? So that was suboptimal, the messaging. The other thing was COVID, there was no cure, still isn't a cure, if you will, but now we have a vaccine. But back then, all you had was testing and contact tracing. And in the communities where the rates were the highest, there were the fewest number of places to get tested. So from a public health crisis standpoint, you go to the people who are most vulnerable, the people who are being most affected and impacted, and there was no one there to help us. So from that the response, the COVID response effort, I can speak specifically in Philly, was not good. And that's where, like you said, you got doctors working day and night to try to make something better for the people in place that needed to do better. So now you fast forward 2 years. Things are better, certainly, than they were. I think that you use it as a learning opportunity so that you never repeat what happened before, right? And people talk about, man, that's amazing. You guys vaccinated 4,000 people in 24 hours. You had a 24-hour vaccinathon. That was amazing and all of that. And while I appreciate that, I also had 70-year-old women waiting in line, 20-degree weather, freezing to get a vaccine. And that should never happen in this country. And so we can't let people forget what has happened. And we need to make sure that we hold our leaders accountable to do the right thing. And that's been largely what my job has been, in addition to taking care of people. And I think people have listened. And it took them longer to listen. But they have.
Doing a good job.
All right.
Thank you.
Another question was very frequently asked, it's mostly among the teenagers, is why is the vaccine pressured onto the youth?
Oh, baby. So, it's so hard. This whole pandemic has gone in waves, right? So initially, way back 2 years ago, when you turned on the news, back when CNN used to show you all the people who had died, everybody was black and brown. Everybody in New York. I was like, dang, is anybody else noticing the trends of what's out here? And it was nursing home residents. So everybody focused on everybody focused on the nursing home residents, right? So it was 65 and up. Then everyone was saying, well, black and brown people are getting it worse, but it's because they don't go to the doctor, right? It's because they don't trust the healthcare system. There were all these reasons, not because there was no access and no resources for them, but that's what was said. So then there was a push to focus there. So after you started getting them tested, after you started getting them vaccinated, you noticed that the vaccination rates in the 65 and up were like 90-something%, right? You noticed that even the 30 to 50 were 80%. Everybody was getting vaccinated. And then what you started seeing in October and November is the rates in children were going through the roof. And the number of deaths in children were going through the roof. So that's why it feels like there's so much pressure on you, because the rates in the children are going up. And I'm calling children everywhere from 15 to 25, that the rates are going up, because now everyone's been back in school. Not like last year where school was canceled every other week and all that. Y'all been in school. Everybody's getting COVID, being on quarantine, being on isolation, coming back. Then the next person has it. But you guys are all meshed in here together. And because the vaccination rates are lowest for your age group, that is why it feels like you're pushing the teenagers the most. Because right now you're the most vulnerable. So you're the most healthy most times, but you're also the most vulnerable, and you're also the way the virus will spread the most, right? Because you're going to feel fine when you have COVID and spread it all over. You won't even know sometimes that you have it. And that's how it's continuing to spread. So that's why it feels like the teenagers are getting pressed.
Thank you.
Okay.
10 minutes? Okay, let me just check. I see.
This next question
Yep, I'm listening.
relates to, you were talking about the shots earlier, and a lot of people want to know which shot is the best for them to get. Because there's different shots by different companies, as we know.
Okay.
So niggas want to know, like which one is the best for them.
So the beautiful thing is, if you are under the age of 18, the only shot you can get is Pfizer, right? And so they only have to think about the other things. If I apologize, I'm seeing. You only have to think about the other things if you're 18 and up. Okay, so which one is best to get? So it just so happens that the one that's available for you, I mean, I shouldn't say it's the best one. It's one of the best, right? It's what I got, my husband got, all my children got, my parents got. You know, I think Pfizer is a good vaccine. And that's not to say Moderna isn't a good vaccine. Now, Johnson & Johnson, we know, had some problems with bleeding and blood clots and so forth. And it was seen primarily in women of childbearing age, right? So up through 50 years of life. So it's not recommended that if you are a woman of childbearing age that you receive that Johnson & Johnson. Also, the boosters should not be Johnson & Johnson. They should be the mRNA vaccines, which are Moderna and Pfizer. So what's available for your age, so I'm going to say 17 to 5 or 5 to 17 years, is Pfizer, and I do think that that's the one you should get.
Okay.
Yeah.
Another question was, in science, it's hard to be 100% certain when it comes to public things such as viruses and just flat out sickness. And we wanted to know the origins of COVID-19 itself.
So that, I have to say honestly, that story has changed a couple times. What I recognize and what I thought to be true is that it was a virus that was first in animals, specifically bats, that mutated and meshed with human cells. And that's how it propagated and became more potent, present, and virulent, right? Then, of course, there are the theories about how it was manufactured in the lab and things like that and whatnot. I don't know if or how you could ever prove that.
I don't think that's possible.
Exactly. But I do know with the science and technology we have, we've been able to map it out, you know, basically as a genome to see which proteins, which base pairs, and all of that were present. And then from that, create a vaccine, right? And so I think that is a blessing. Where did it come from? We know that at least the first time it was seen was in China, was in Wuhan, China, around that Chinese New Year in January of 2020, really November, December 2019, and so forth. And so I still believe that there was some origin from the animals, and there's also a precedent for that with birds. There was the swine flu. Good? Okay. Can you let me know? Okay. With the swine flu, remember that? H1N1, well, y'all might not.
I think we were like
babies
for that.
10 years ago. How old are you now?
I'm 15.
Oh, poor thing. You were 5, so y'all weren't thinking. You remember H1N1. Because I was pregnant at the time. And again, pregnant women are immunosuppressed. I was in the hospital, and a pediatrician said to me, "Doc, you don't look well today." And I was like, "Oh, I probably had a flu." Like, that's what people say all the time. "Oh, I probably had a flu." And she was like, "Well, let me swab you." And on the ward, she swabbed my nose. And I went back. I was seeing patients. And back then, you're not wearing masks. I had been in the OR operating all day. My stomach's big. I'm like walking around, whatever. And I hear on the loudspeaker, "Dr. Stanford, could you report to the ER stat?" Right? So I get to the emergency department thinking there's a pediatric trauma or they need me to do something to manage. And they're like, "You tested positive for H1N1 or swine flu, and we need to isolate you immediately." So they put me in this room. They put me in a mask. They gave me an antiviral drug. And I was basically on isolation. I couldn't see my family. I couldn't see my kids. I couldn't take care of any patients. And they had to trace back for every patient that I had operated on that day. Now, fortunately, I was in the operating room with the mask on, but I had touched patients all day long, right? And they were coming to do ultrasounds on my baby to make sure the babies were alive. It was very, very scary. And it happened, and again, pregnant women were impacted the most. So I know from firsthand experience what it means to be vulnerable as a pregnant woman in the midst of a viral disease and whatnot. But that being said, they called that the swine flu. So that was from pig, you've heard of avian flu from a bird, and then this one, I believe, came from a bat or another animal. So that's the origin. Okay. What else you got?
Well, another question is, how long do I have to wait from recovering COVID-19 to get the vaccine?
Okay, so how long to wait? 10 to 14 days. 10 to 14 days. And no symptoms. I don't believe you need a test to say that you're negative and things like that. Just 10 to 14 days, and you feel better. Like if you're still sick, you shouldn't be getting a COVID vaccine. The COVID vaccine does not cure COVID. I remember back in February last year, I was pissed. We had these college students show up, and they knew they had COVID, and they came to get vaccinated because they were like, well, maybe it's going to cure my COVID. Anyway, that's why you wait 10 days. 10 to 14.
Wow. Okay. Another question that I have, which I'm very curious about myself, is why can't you get both doses of the vaccine at the same time?
Okay, that's good. So that has something to do with, he said, why can't you get both doses of the vaccine at the same time? It has something to do with, have you ever taken a Tylenol, for example? And you might take it every 4 hours or every 6 hours, but the maximum amount you can take in a day is 4,000 milligrams or 4 grams, right? If you take too much, it's toxic to your liver. It can actually cause liver failure, right? So if you took too much of the vaccine at once, it would be toxic. It could be toxic to your body, right? And cause more of an immune response than you need. That's why there's a maximum amount per day. The other thing it allows is it's just enough, but not too much, for your immune system to say, and be triggered to say, oh, let me try to fight this off. You don't want to overpower your immune system. Then you wait that 3-week period in between to then boost it up, what has happened. So that's what that second dose is for.
Okay.
It's a good question. Really good. And another point, that's why it's so important with the children, right? Because with the children, the doses of Tylenol, the doses of vaccine are all dependent on the weight of the child. So the dose that we get as adults, or the dose that you would get, how old are you?
16.
16. So the dose, you and I would get the same dose. It's different than the dose you would give an 8-year-old because the physiology changes as you get older. So an 8-year-old does not need as high a dose as a 17-year-old, right? The same is true. So that's why now we don't have it yet for our 6 months to our 4-year-old, because you got to get just the right dose. You want to give them enough to be protective, and you don't want to give them too much to make them sick, right? And so that's why.
All right, Zai.
Okay, and I'm sorry.
That's okay.
and
Oh, okay.
And to wrap up the podcast, I want to say thank you, and it's very honorable to have you here today and answer our questions. And we're very grateful to have you here and give us this information that we needed.
Thank
and
you.
that's the end for the podcast.
Oh, you're so welcome.